and I'm an MPH student at Liberty University. I completed my practicum with Give Hope, Fight Poverty in Eswatini, South Africa, known as Swaziland, and its people are known for their resilience and their strong sense of community. However, those people in Eswatini suffer high prevalence of HIV, and unfortunately many children have been orphaned due to the high demand for caregivers and the numerous amount of child-head households. Some children as young as 12 orphaned by HIV and its damage to this community. Give Hope, Fight Poverty gives these children resources such as food to fight poverty, health interventions, school meals, assists with their education. They support primary schools. They planted plenty of avocado trees. They also start many businesses with these young children as they grow into adulthood, giving them a means to support themselves in the future. There's been rain catch systems implemented, chicken coops, scholarships for education, and other programs funded by Give Hope, Fight Poverty. The service learning program or experience was for any professional or student to travel to South Africa, experience the culture, immerse themselves in the community, and also with the people and those affected by the HIV epidemic, and also TB is a coexisting illness that this community faces and has to continue testing and learning about to stop the spread of these two illnesses. Poverty and illiteracy are also a big concern for this community. During this practicum experience, I met many people. I went to schools, got to partake in getting supplies to build homes, latrines, teaching children that for the deaf and the blind and those disabled, as well as health interventions with poverty and testing of HIV and TB status. My intervention focused on these health challenges for Eswatini, on the HIV, tuberculosis, maternal health, child health, malnutrition, and access to health care. I wanted to increase testing awareness of HIV and tuberculosis and maternal and child health services, and reduce the malnutrition rate among the children in this community. The mission and value of Give Hope, Fight Poverty is it's a nonprofit focused on reducing poverty in these rural areas, especially Eswatini, and to educate and empower and lift the orphans that are vulnerable in this community out of poverty, especially these child-headed households. Give Hope, Fight Poverty planted fruit trees and has had an impact on over 120,000 orphans in Eswatini. However, the number of children needing care exceeds the number of caregivers available in this community. Give Hope, Fight Poverty accepts donations. They also have Facebook pages, Twitter, and also reoccurring trips for others to experience this culture, this beautiful atmosphere, and the safari animals and the people, and to just do something that makes you feel good and helps other people. What I learned during this experience is that I gained some new skills on socializing, especially with others from a different community, a different language, a different part of the world. And I also became a little more resourceful in realizing that in the US we do have some conveniences that aren't available in this community, such as power, running water, grocery stores, such as Walmart. Most of the stores that I encountered in this area were on the road shops where other families were growing plants and fruits and vegetables and selling animals for meat. I did get an opportunity to analyze data and collect data more efficiently during this experience, and I've honed in some problem-solving skills while visiting South Africa, and as well as my return here and working on my practicum here in the States. I gained a deeper understanding of health interventions and communities and its impact and effects, and it's broadened my perspective on global health issues altogether. Things I would do differently. If I had the chance to do it again, I would prioritize more on time management and planning. There were times where the workload during the trip and back home in the States seemed overwhelming, and I feel like if I had better organization, I could have alleviated some of my stress. And asking for more feedback from my mentors and my peers throughout the whole process, I would allocate more time for reflection and self-assessment to ensure that I was continuously improving. Challenges that I didn't anticipate. One was in the whole engaging of the local community. I underestimated the cultural and the language barriers. It's not a government-funded community. They're run by a king, and this king oversees everything. And the only people that seem to be fortunate or the haves were relatives of the king, or maybe his wives or their children, or it's definitely a different governmental system altogether. And it was hard to build trust with the local community, because here I am, this person coming in behind this nonprofit that has established themselves for sure. But I do feel like there's so much more to be done, and financially there's more help needed for this foundation to continue to do the good work of God and helping this community prosper and these children live happy, healthy lives moving forward. I was definitely taught the importance of cultural sensitivity and how to adapt in public health. Through this experience, I gained hands-on experience, of course, and I have a boosted confidence in what I'm capable of doing as a public health professional. I had valuable insights that I gained that I couldn't have gotten just from being in a class or not having this hands-on experience altogether. It's definitely shaped my career path moving forward and reinforced my passion for public health altogether. From a Christian viewpoint, the efforts of Give Hope, Fight Poverty in Eswatini resonate with the biblical mandate that to care for orphans and those in need. James 1:27 highlights The true faith involves helping orphans and widows in their hardships. By offering education, healthcare, sustainable support, Give Hope Fight Poverty reflects love and compassion taught by Jesus. The initiative embodied the principle of being Christ's hands and feet and aiding those and empowering them to improve their lives. Matthew 25:40 says, whatever you did for one of the least of these brothers and sisters of mine, you have done for me. The mission not only addressed the immediate needs, but promoted long-term change in the community and a brighter future for these children. And through faith and action, this nonprofit, Give Hope Fight Poverty, brings hope and shows God's love in the most practical of ways. I hope there are more students that choose to experience this opportunity that this foundation offers. It's definitely a once-in-a-lifetime thing, and I will never forget my experience there, the people that I met. And I'm very thankful to God and everyone for allowing me this opportunity. Thank you very much.